Many states are adding work requirements to their public benefits programs. We're going to look at what it means to have a work requirement and then look at a few states as examples and talk about some impacts of those rules. But first, let's just ask the question, what is a work requirement? Well, simply stated, it's mandating employment as an eligibility criteria to receive public benefits. It means you have to have a job to get public benefits. The way that's defined depends on which state you're in. So most recently, states have been asking the federal government for permission to add work requirements or having to have a job as a requirement to get Medicaid. They can't just do this on their own. They have to ask federal permission to waive existing Medicaid rules that don't include mandating work as a requirement to be able to allow this step. Other public benefits programs, such as some housing programs and some food assistance programs, already have this work requirement in them in different capacities. We're going to center our attention today on that Medicaid waiver request coming in from a few states, what that looks like, and how many hours of work, are there alternatives to work that would be considered, exemptions, etc., and then talk about some of the implications of that. Now, we're talking about Section 1115 demonstration waivers. States submit a waiver request to the federal government asking that they can waive part of the rules as established in the federal Medicaid program to be able to mandate work. Now, waivers traditionally are allowed in the field of asking to improve a state Medicaid program. So what the states are actually asking for is a work requirement to improve their Medicaid program. And right out of the gate, that's where a lot of health policy experts and advocates find trouble with these waiver requests. But we'll talk more about that in a second. Let's look at Wisconsin's waiver request, just the work piece, and compare that to another state, Kentucky. Let's start with what Wisconsin is asking for. Wisconsin wants to add a criteria that says an individual must work 80 hours a month to remain eligible for health care coverage in the Medicaid program. They're targeting adults without dependent children in the home that don't have a disabling condition, as defined by the Disability Determination Bureau. So very specific exemption there for folks that might have a disabling condition. But 80 hours a month is the threshold of work you have to prove to be able to keep your Medicaid, as proposed. This is about 20 hours a week of work, so part-time work. Now, they define work as work or participation in an employment training program. And Wisconsin points to its Wisconsin Food Share Employment and Training Program as the model of a training program. This FSET program was implemented in Wisconsin a couple years ago. It started as a pilot project. It got expanded. Wisconsin found that that people were being kicked off of food share for not being able to find work 3 times as often as they were joining the workforce. So it was a failed experiment to do it in the food share program, but nevertheless, Wisconsin is pointing to that as the model that they want to replicate in the Medicaid program. Now, if you don't find work in the Medicaid program, your enrollment is limited to 48 months' time. They're putting a time duration on how long you can get Medicaid if you don't comply with this work requirement. The federal government is still reviewing this proposal. It has not been approved yet. And some folks are pointing to this time-limited Medicaid as a part that even this administration could not approve. It appears to violate Medicaid law, plain and simply. Now, there are some areas where you can claim an exemption, like we said, if you have a disabling condition, if you have children in the home. But this is the way that Wisconsin wants to ask for people in the Medicaid program to work. Kentucky has a similar hours threshold. Kentucky has already had their waiver approved by the federal government. They were one of the first states to have their waiver approved, and they will be implementing work requirements as of July 1st if nothing gets in the way, and we'll talk about that if in just a second. They have an 80 hours a month criteria as well. Their definition of work is a little bit broader. They point to a community engagement requirement, which includes job skills training, searching for a job, and education for a job, GED classes or community college enrollment, employment, community work experience, or volunteering, or taking care of a relative or other person with a disabling health condition. A caretaker exemption qualifies as work in the Kentucky program. There also are other exemptions if you do have a disabling condition that's verified by the Disability Determination Bureau in that state. So Kentucky's definition of work seems to be a little bit broader, falling under the community engagement headline that they use. There are, just to give a quick example, a couple other requests that were asked for in each state's waiver. Wisconsin wants to add premiums, a health risk assessment, drug testing to their waiver. Kentucky wants to add premiums and cost sharing, benefits cuts, health savings accounts, a competition for what is called My Reward dollars. If you can meet the requirements of staying healthy and doing your checkups like you're supposed to, you're going to earn points, and points can be used for things like dental care. So kind of a little convoluted way of getting extra services in the Medicaid program in Kentucky. The difference that we're pointing to is Wisconsin is not a Medicaid expansion state. Kentucky is a Medicaid expansion state. So we're looking at a little bit different population here, but generally you get the sense of what the feds are looking at for Wisconsin and what they have already approved for Kentucky. Now we point to Kentucky as a comparison for Wisconsin with their more generous definition of work because it's under legal challenge. In fact, oral arguments were just held last week on a summary judgment motion with a lawsuit brought by a class action, a group of Kentuckians that felt like the work requirement was illegal. They were supported by the National Health Law Center, the Southern Poverty Law Center, other like-minded Kentuckians and advocacy groups that challenged in the suit Stewart versus Azar. And they're challenging the approval of Kentucky's waiver, specifically the work requirements, although they also do speak to some of the other provisions of the waiver. Now, the majority of people in Medicaid are already working was part of the argument. We saw data from the Kaiser Foundation on this as well. There's no evidence that mandatory work makes people healthy, so the premise of the work requirement argument isn't even there. In fact, the evidence actually points the other way. There is evidence that health coverage helps people gain and maintain employment. You have to be healthy to work. You don't need to be working to get healthy. And the effect overall of these waivers, the proposed one from Wisconsin and the implemented one for Kentucky, is simply to cut enrollment in the program. There is a huge incentive for the state to be dropping people for not meeting the more onerous administrative hoops and hurdles requirements of having to meet these rules, because people, like we said, are already working. They now just have to prove they're working, and that's where people could actually lose coverage, because proving employment can be very difficult. There's a lot of administrative paperwork involved, and some states, like Arkansas, want to use strictly online systems for reporting work. And there are more recent studies coming out showing the lack of online access and email access for this population. Now, proving work will be a challenge. Proving exemptions will also be hard. So someone that should be exempt from the work requirement because of, in the state of Kentucky, perhaps being a caretaker, would still have to claim that exemption, but that process itself could be onerous. It's, again, hoops and hurdles in the way of people that are otherwise eligible for health care, but just can't get through the paperwork. Now, overall, the argument at the root of the lawsuit, Stewart versus Azar, was that work requirements are inconsistent with Medicaid's objectives for fostering access to health care and coverage. Remember, we started by saying you can request a waiver if you can prove it will improve your Medicaid program in your state, and that's where this lawsuit really centers, that work requirements are not going to improve Medicaid in any particular state, and in fact, they're going to make it worse. You can read Wisconsin's waiver proposal and Kentucky's waiver as approved. We give you the links to those. The National Health Law Program also has some fast facts. They were part of the litigants in that summary judgment oral argument just last week. They provide a lot of resources on their website to talk through, and they also track waivers in other states as well, other than the ones that we just spoke to today. You can share your story. You can tell us what you think about work requirements and Medicaid programs. If you think Wisconsin's waiver will be successfully approved by the feds anytime soon, you can also share your questions, and you can send us an email, and you can do all of that from healthwatchwisconsin.org.